Hey folks, Dr. McCarthy, and I want to congratulate you on scheduling your type 2 diabetes discovery call. I just want to go through this short video with you, kind of set the stage for you, let you know some of the things that we're going to talk about and how our method is different than anything else that you've ever seen before, and how we're going to go about helping you basically get your life back. Just a little bit of background on myself. I am a functional medicine practitioner. I graduated as a chiropractor in 1993. I've been at this for 28 years now, but it's really the past 20, 25 years, 23 years or so that I got involved with helping folks that are dealing with type 2 diabetes. When I took a class with this fellow here, Dr. David Seaman, wrote this book, Clinical Nutrition for Pain, Inflammation, and Tissue Healing. And that's when I realized, wow, being a chiropractor is fantastic, but if I could change people's diets, you can really change people's lives. So it first started me helping folks who were dealing with pain. But then when we started delving into inflammation, we're going to talk about that a lot today. I realized that you can help folks with a lot more challenging issues. And it's been so rewarding for me over the years. I get up at 5 o'clock in the morning every day so I can become a better me. And I do stuff like, study this book and, the newest cutting edge research. And the better me I can become, the better you are going to be able to come. But you've got to take a role in this, and you've got to be invested, and you've got to be motivated, and you've got decisions to make at this point. You have to decide. Let's say you have the label of type 2 diabetes. You have two choices. You can believe that the diagnosis of type 2 diabetes is more powerful than your body's ability to heal itself. And that's where many folks are just stuck. But the folks that get results here in our office are the ones who believe that their body's ability to heal, when put in the proper environment, which is my job, is more powerful than the diagnosis hung around their neck by the medical doctors. If that's you, you're in the right place. So again, thanks for scheduling your call. I'm going to give you the keys to the kingdom. I'm going to show you exactly how to do this. I've done it, hundreds of times. Type 2 diabetes is reversible. Some scary numbers with diabetes. You saw it on the first video that you watched. These are the projected diagnosed cases. So this chart here is even a little bit old, and they've actually underprojected the cases. There's 34 million Americans who have diabetes. That's 1 in 10. 1 in 10 people have diabetes. That's abysmal. And, we only projected that in 2020 that there was going to be around 20 million people. So this isn't even really good, but just look at the numbers. Look how it's booming. And then what goes along with that is the 88 million, 1 in 3 Americans that have pre-diabetes, and 84% of those folks don't have any symptoms, so they're slowly dying. And you're going to wind up with the neuropathies and the retinopathies and dialysis. And what goes along with that? Obesity. The standard American diet is killing people. And if you look at this chart carefully, 1960 to 1980 was only about, 13 to 15% of the population were classified as obese. And then somewhere around 1980, we had those first dietary guidelines for Americans, the pyramid. And that's when we were just going to change the world. We were going to make people so healthy. And look at what happens to the chart here. We went from 15% of the population obese up to over 35% in just 2005. And it's still on the rise. Scary stuff. But, if you look at the correlation between the two charts. Same angle, same progression. It's horrible. Diabetes is a huge problem. If you just look at Google, you look at there's millions and millions of searches every month for diabetes. That one's like 2 million searches per month. Pre-diabetes, look at the chart there. How many searches are going on there. It's through the roof. It is a huge growing problem. And this is the reason why. The standard American diet. And if you look at the blue zone right in the middle of that chart there, that's the ideal balanced blood sugar. The problem is that the standard American diet makes us get onto this roller coaster. And if we eat this way, this is a surefire way to develop type 2 diabetes. Type 2 diabetes, you do have a genetic predisposition to it, but it's environmentally induced. If you change what you're putting in your mouth, you can click the gene on. You change again what you're putting in your mouth, and I'm going to tell you exactly how to do that, customized specifically and individually for you. You can click the gene back off. We've had people that are actually injecting insulin who are no longer injecting insulin. You know, their doctor says you got to stop with the insulin. You're well. So you know, we need to work on a lot of different things, but the standard American diet's one of them. And the stuff that we eat is just sugar, refined carbohydrates. It just turns into sugar inside your body. So you get that spike of sugar and your insulin goes up through the roof. And insulin is a bad mamma jamma. You know, it's an absolutely necessary hormone inside your body, but you want as little insulin floating around inside your body as possible. And insulin has been theorized to be the culprit in destroying nerve tissue. And so when you get your high blood sugar, because you eat your, you know, even it doesn't even have to be cakes and cookies, you know, that we think of as sweets, but if you eat bread and subs and pasta, that's sugar. So you get these spikes of sugar. Your body has to produce a lot of insulin to drive down your sugar, to get the sugar into the cells and to lower your blood sugar. And when that happens, these insulin surges over time start to destroy nerve tissue, hands, feet, numbness, tingling, peripheral neuropathy, but also brain tissue. And, you know, we see the rise in cognitive decline here in this country, whether it's, you know, Lewy body dementia, cognitive issues, Alzheimer's. Many people call Alzheimer's type 3 diabetes. This diet is exactly why. So you go from that insulin surge, then you crash, you know, in the afternoon, you get tired. I just need a Snickers bar or a coffee with a bunch of sugar in it. Your body produces cortisol. When your body produces cortisol, you know, that's when you get fat. You can't lose weight. If this is the way that you're eating, can you read that? FAT? My head's in the way, I guess, a little bit. But you're eating this stuff, the breads and the buns and the fries and the cakes and the pizzas, you know, that's turning into sugar. You're on the roller coaster. Your blood sugar level starts to get high. And when it gets high, you become insulin resistant. And insulin resistant is what's leading towards diabetes. But again, you know, like I said, it's the diet. We've got to figure out what the diet is right for you. You see things like you get hanger or hangry, mood swings, sugar cravings, energy crashes, depression through the roof. So all related to your diet. And these are things that we go over with you in our book, The McCarthy Method, Unlock a New You. So when we talk about these things, you know, I give you a copy of the book. And in the book, it talks about like hidden sugars. And so now we have, you know, come to think about like table sugar as being bad, but we've got all these other sugars. And if you look at food ingredients, you know, we were taught to read labels, hogwash. Look, if food has a label, you shouldn't be eating it. If it's got an ingredient list, it's not food anymore. You know, it's synthetic stuff. It's Frankenfood. It's made in the laboratory. It's not good for you. And in this country, we allow the food manufacturers to put in all kinds of chemicals to trick your brain into thinking that this food is delicious when it's in fact it's synthetic chemicals. There's chemicals in there. And if you look at the same foods that are produced and sold in other countries, those countries don't allow those chemicals in the food, but the standard American diet does. Why? I don't know. You'd have to ask the powers that be in the government and the FDA and whatever, but it's killing you. It's killing you. It's creating type 2 diabetes. The obesity we talked about, most folks who are dealing with type 2 diabetes are overweight. And, you know, you can't lose weight. Well, that just compounds your problem, because when you're overweight, inflammation goes up. So, it's a real medical conundrum, because in this case, we wait until you get to the point where you are diabetic. Pre-diabetes, we just sit and watch, which basically means I'm just waiting and doing nothing and waiting for you to get to the point where you're bad enough that we're going to put you on drugs. This is a conundrum. So millions of Americans are suffering from inflammation. Like when I started reading, going to Dr. Seaman's seminars, this is where we really started to delve into inflammation. And inflammation drives every disease known to man. So if you're eating this diet, it creates inflammation. You've got type 2 diabetes. Now you're obese. Don't you think that, what's coming next? Cancer, heart disease, stroke, a heart attack, all driven by chronic inflammation. And again, the good news is we give you the keys to the kingdom to undo this. And it takes time and it takes effort, but if you're motivated, you can get well. The average American is eating 150 pounds of sugar every year. 150 pounds of sugar, which all drives inflammation. We're going to show you how to fix that. What we really think about when we're making these changes is making changes at a cell level, because you can't get someone healthy unless you get their cells healthy. So if you look over to the healthy cell, you see there's oxygen and nutrients going into the cell and waste products coming out of the cell. But from a lifetime of inflammation and eating crap, your cells start to dysfunction until it eventually turns into a diseased cell. And insulin drives this process, and insulin can't get into your cell when it's not a healthy cell. And so what you need to do is think of getting yourself healthy on a cellular basis so that your whole body can become healthy again. This is not your answer. This is the answer that many people think. You need to donate to this research organization and that research organization so we can find the magic pill to cure type 2 diabetes. There is none. Change what you're putting in your mouth. That's the cure. There's not a magic pill. You take responsibility. You think that your body's ability to heal is more powerful than the label that they put around your neck, and you can get yourself well. I'm going to help you do it. I'm going to give you the keys to the kingdom so we can get these cells healthy and get you healthy. So again, I just wanted to congratulate you on setting up your call. I really look forward to talking to you. This is really what just, warms my heart, is being able to help folks who feel like they're at their wit's end. I'm going to tell you this. I can't give you any guarantees or any promises, but I promise you this. You have never met a doctor before in your life who's going to work harder to help you get your life back. Thank you. God bless you.